So to switch the machine on, we use the power switch here on the side of the OCT, like so, and the device will come to life. You don't have to switch it on in any particular order. You can turn the computer on first or the OCT on first, it doesn't actually matter in this case. As you notice here, we have the main joystick which moves the device backwards, forwards, left, right, and also if you turn the joystick it moves the OCT up and down. There is a button on the top which is used when we want to capture images in manual mode. You'll also notice here there's a button which says OPT, that's for optimize, again when you're in manual mode to optimize OCT scans. These arrows, these buttons here with the arrows on, are to move the chin rest up and down for the patient comfort. We have a securing brake here which is primarily to keep the device from moving about too much, either when you're moving it around on a table or on a combi unit. And we also have a safety lock here on this side, which is if you're using the anterior module to make sure you don't push the device into the patient's eye. There's also a button here which allows you to change what we call capture screen and also do manual focusing. Here on the side of the device we have the compensation lens. This is used for two things. First of all, if you have a patient with a very high prescription, you can pull it out very, very slightly for high myopes, slightly further for high hyperopes. Also, when it's fully extended like so, it allows us to take anterior photographs of the eye. It's also important, of course, to remember to remove the lens cap, which is here, which you can then click to the side of the device like so. It's also a good idea, of course, to replace that, I would probably say, every time you've used the device in certain environments, certainly every day. We can also use this LED fixation lamp, which is movable, particularly useful when we capture anterior OCT images where the patient may have problems with their fixation. Certainly also useful for patients with maybe AMD, where central fixation is quite poor, and certainly if the other eye is functioning better, it may be that you'll actually use the other eye to fixate to get an image for the poor eye, as it were. So using the chin rest buttons here, you can move the chin rest up and down. It's important that we get the patient comfortable at the device because they may be sat for certainly a minute, maybe 2 minutes. And of course, this is the canthus marker that the patient's eye needs to be level with when they're sat at the instrument. Looking at the touch screen on the OCT device itself, the first thing to notice is that it tells us which eye that we're on. It says R here for right. If we move it slightly, ever so slightly, it will now say L to the left. It also tells us which mode that we're in. OCT FC is OCT followed by fundus camera mode. We can click on combo, OCT FC, just OCT, or just FC for fundus camera. In fundus camera mode here we have the normal standard image. You can capture disc stereo images, panoramic images, and also anterior images. If we click on anterior, it will tell us to switch to the compensation lens which we saw earlier. And if we switch back to normal image, we have to push the compensation lens back in, like so. If we go back to OCT mode or OCT FC mode, you'll also notice some other symbols down here. These two buttons here are to change the intensity of the fundus camera flash, up or down, or very quickly down to a much lower level here. SP stands for small pupil, which you can have the device go automatically into for small pupils, or you can select it manually when you know that the patient hasn't been dilated and have small pupils. Also here you have fundus autofluorescence or FAF. When you click on that, it will say charging because it uses a very bright green flash. And if you click it again, it will say discharging, like so. Here, this symbol tells us that the device is in auto mode. If we click on it, you can switch to manual and once again back to auto. And if the device is in capture mode, you can utilize this button to stop the scan or start the scan. When we're in OCT mode, like so, it also tells us here on these symbols that we're on posterior mode, but you can click on here to switch to anterior mode for corneal scans. Alternatively, if we go back to the normal OCT or posterior mode, If you click where it says macular map here, it then gives us a list of all the available scan patterns that we've already been through, and again allows us to switch sensitivity from regular to fine or ultrafine, and we can even change the level of detail on the number of A scans. So lots of variability also at the device itself, not just with the computer. When you've entered a patient, it will have the patient's details up here in this bar, and if you actually press on the bar, it would normally, in a patient mode, capture mode, allow you to see the full patient details. Finally, this symbol here would tell you if it was flashing or highlighted that the patient's eyes are not open wide enough, and of course that can be an issue when capturing certainly colour fundus images, but sometimes OCT scans as well. And here centrally, of course, we have the targets which we line up with the patient's pupil. The touch LED screen can also move or tilt, so if we lift it to a position where we might be stood, then you can ratchet it up, but if you want to bring it back down, you have to lift it right to the top, release once, release again, and it allows us to move it all the way down.